Are your kids constipated? Are you, for that matter? But we're just going to focus on the kids today. We have a little 9-year-old visiting us, and she and her family came from many hours away. And I was speaking to her parents. She has a hiatal hernia. If you haven't heard about hiatal hernia syndrome, I definitely recommend you check out my other videos on the topic. But the dad was saying, he said, we were so surprised to find out she was constipated because she goes every day. And but what she would be doing is like a little rock, basically. But it's something, once you've had that experience, like, wow, ask the next question. And I mean, she's only 9 years old. It's like, let me see what you did, and kind of look at the product of going to the bathroom. But reminds me of a young man, boy, I think he was 10 or 11, and the way the mom found out he was bleeding when he went to the bathroom, he had actually ulcerative colitis, but she found that out because he was grossing out his little brother by showing him the toilet. So, boys will be boys, but the facts are that it's important to talk about. It's very important that you talk to your children about pooping, and not just how often, but what it looks like. Are they straining? What's the color? These are all very, very important points, and they should be moving their bowels once or twice a day. It should be a nice long brown banana, so it should be easy to pass, optimally all in one piece, certainly not in little chunks. And it's a medium brown color. It's not black, it's not yellow, it's not green. It's just a nice medium brown, and that's a typical healthy bowel movement. So they shouldn't be uncomfortable. It should just be, I have to poop, I poop, I'm done. Some of the kids call it ghost poop, which means there's not much to wipe after you use the restroom. So there's not a lot on the toilet paper, versus if it's sticky, just very annoying. But it also means, it can mean a few different things. One of them is fat malabsorption, but the poop is sticky, and so you're wiping and you're wiping and you're wiping, and it's just very hard to get cleaned up. So these are all things that I really recommend that you talk to your children about. Then, of course, it's get to the root cause and fix it, which is extremely important, because these are toxins. These are toxins that your child's body is not getting rid of. Therefore, the bad organisms in the colon are reproducing, and that's could create such a host of different problems, from behavior problems to trouble sleeping, to fatigue, to cognitive problems. They're not doing as well in school, little older hormonal imbalance, headaches. The list goes on, and it's such an easy thing to know. But bathroom time is private time. But as a parent, it's like, hey, I'm encouraging you to eat your vegetables for a reason. I'm encouraging you to show me your poop for a reason. And it's worthwhile. It's absolutely worthwhile. So let us know if you need any assistance once you find out the nature of that poop, and if it's not quite right. It's certainly not hard to fix, really, with anyone, especially with little ones, but so worth it. I hope you found this video helpful. If you want more on this topic and others, click here.